All right, awesome. John, I think we're good to get started. How you doing today, John?
I'm doing great. How you doing, Alex?
I'm doing pretty well, pretty well. So we definitely, like I said just now, we have a bunch of good questions. You also have some of your reporting. So why don't we start with some of your recent reporting from the past week? I know you've done some reporting on telehealth, kind of how important it's been for people and how it's being debated right now. And then we can talk a little bit about school openings, and then we'll dive into some of the questions that we have. But why don't we start it off with kind of those two topics?
Sure. So telehealth is something that many of us didn't need to think about at all until the pandemic hit, and then we needed to see our doctor. Uh, and so the reimbursement rate right now, because of the state of emergency order that Governor Charlie Baker has put in place, he has allowed doctors to be reimbursed for the same rate as seeing someone in person. And the insurance companies went along with that. Everyone said, okay, let's just do it for now to make sure people can get the medical care they need. But the question is, when that state of emergency is lifted, should doctors get fully reimbursed for telehealth or not? The idea of telemedicine for a long time was that it would be a cheaper alternative to in-person visits, that would reduce the cost of healthcare. And it's not turning out to be the case right now. The doctors and the hospitals, of course, would like more reimbursement. They'd like to continue this, what's called rate parity. They'd like to continue to get the same rates because they say it's just as expensive, if not more expensive, because they have to build these new, computer systems to do telehealth. And they have to maintain their old offices and staff anyway. So it's not saving them money. So they really want the insurance companies to reimburse them fully for telehealth, at least for the next couple of years. On the insurance side, the insurance are saying, no, we need, maybe for behavioral health. I think just about everyone agrees that mental health visits are almost as effective as in person as over the computer. And so they want to maintain rate parity for that. But the insurance companies in Massachusetts, and they're companies, but they're not generally nonprofit companies, are really arguing, saying we gotta hold the line on costs a bit. Let's not continue rate parity for a lot of these other visits. And that's the debate that's happening at the State House. Simply put, the Senate bill is a little more along the lines of what the hospitals and doctors want, and the House bill is much more reluctant to go full force into telehealth. The top negotiator for the House told me that it's less about sort of saving money for patients and more he is concerned about credentials and HIPAA or privacy issues. Like he wants to make sure that you just, like, anybody can't just get a degree anywhere in the world and start delivering care to Massachusetts patients. Now, right now, I don't think you can pull that off. But he wants to make sure that the law is clear that you need to be credentialed in Massachusetts. So this is this is right now. And what you have on the side is you have business groups that are representing small businesses, namely the NFIB and the Retailers Association of Massachusetts, that are lobbying hard. They've sort of joined or allied with the insurance companies to try to control premiums. They're saying, our members, before COVID hit, health insurance premiums are one of the biggest threats to their business. And we've got to get those health insurance costs in line, or pull them back, or at least stop them from escalating so much. So they're lobbying right now to keep costs down if possible, while the hospitals and the doctors are saying you should provide as much reimbursement as possible for as long as possible, because we need this safety net during the pandemic and afterwards as well. And so there's that tension that's happening. And I think we'll just see sort of in the end, it'll be a compromise between both sides in terms of what services get covered and for how long they'll be covered fully. I think in the long run, there will be a different, like after 2 years, there'll probably be some differential where doctors get paid a little less for telehealth, but they really want this protection now during the pandemic to get full reimbursement.
Talk a little bit about the school reopenings. Kind of, I know it's different everywhere, but anything you're hearing kind of in the local area about, school reopenings.
Yeah, it's really, everyone has been filing, every school district has pretty much come up, I would say every, but almost all of them are done with trying to decide which route to go. I would say around Boston, the most common prevailing public option is that it's a hybrid, which means you can send your kids to school 2 days a week. Oftentimes, it's just half days for those 2 days, and the rest is done remote. Or you can send, many of the school districts give you a remote option as well to the hybrid. Some, some are waiting longer to start school. A lot of the state allowed schools essentially to start a week late to give the teachers more time to prepare. And so you're seeing many school districts take advantage of that. You are seeing private schools, Catholic schools, I would say they are going to be more likely to go in full in person. There are some public schools in Massachusetts that are going in person, particularly for the lower grades. But private schools, Catholic schools have a little more flexibility. To be honest, some of it has to do with whether their workforce is unionized, and in public schools, they are unionized, and the private and Catholic schools are not. And so that gives them more flexibility. And I think they're trying as best they can in those situations to keep kids in with their teacher, and they're doing sort of virtual specialty classes like music, via the televisions or computer screens in the classrooms. So you're not having as many teachers interact with kids. But it's really going to be tricky. I don't think you can have a school where you just have the same, like 12 kids and a teacher in a classroom, and they don't interact with anyone else in the school. So there's sort of no easy way around it. And of course, it's a challenge for businesses because it makes it that much harder for people to get back to the office if they have kids at home. If so few of the public school districts are going back full time this fall.
Definitely. I think it's a good segue into the first question, where there's also not really a universal plan across the country, at least. But we had our first question about gyms and kind of some of the coverage around gyms. It seems like there's no universal opinion, if going to the gym is safe or not. So the question that we had was from a gym owner, kind of about the coverage of gyms, kind of some reporters suggesting that it's not safe to go to a gym. Some obviously governors reopening the gyms, right away a few months ago. So talk a little bit about, anything that you're hearing about the gym industry. Massachusetts was a little bit later than some states in terms of reopening the gyms. So talk a bit about, from your perspective as a reporter, about, what you're seeing, not just in the local area, but I guess nationally as well, in terms of, suggestions and kind of the reporting around gyms.
Well, obviously gyms were a little later here in Massachusetts and in many states. They were not allowed to open until phase 3. And there was definitely a concerted push from the fitness clubs to get in earlier. And I think the owners say, well, we can do it safely. You can do social distancing. You're disinfecting the machines. People are wearing masks. I have heard, anecdotal stories about people going to the gyms and seeing people not wearing masks. And personally, I don't know if I'd feel comfortable working out next to someone where that was the case. When I run outside, I carry a mask and I put it on when I get anywhere near somebody, but most of the time I'm outside, out in the roads, and I don't see anybody for miles. And so that's a way I'm preferring to work out, or I'll go to the Walden Pond is a great place to swim. It's getting pretty crowded this summer because of the pool situation, but I'll go for swims there too. I do think it's a challenge for gym owners, particularly to get new people to sign up right now, because I think you have some people who the gyms were such an important part of their routine. that they couldn't wait to go back, but you had so many others that were sort of developed new routines. I think running is a perfect example where sales of online running shoes, online sales of running shoes really took off during the pandemic. A lot of the running shoe stores were closed, but people really wanted to get out there and run because their gyms were closed. So and the same thing, we saw this with bikes too. There's a real bike shortage. And so the competition, people working out is kind of one of these habits that you get every day. And if you get out of the habit, and you could probably go for vacation a week or two and come back and get your old habits. But after 3 months, I think a lot of people have developed new fitness habits. We'll see how that changes though, as it gets colder around here. I think, you might see more people wanting to work out indoors, and that could be good for gyms. I do understand and sympathize with gym owners, because I'm sure they look and they think, what more can I do to make this safer? I'm really trying to make it safe. And there's just some people that do not feel comfortable spending much time indoors anywhere except for their house right now.
Definitely. We had another question. What's your opinion or any reporting on a second PPP program? Because this person says small businesses need another round to stay open. Do you have any insight into that?
Well, right now, as I'm sure many of the people listening in here are aware, that there's a big impasse in Washington over the next stimulus program. The good news for small businesses is there is some money in both of the House and the Senate bills for small businesses. They sort of are, I guess you could call it either an extension of the PPP or it's an evolution of the PPP. It's not going to be quite the same. The big holdup there is the House. I mean, besides the fact the House wants to spend a lot more than the Senate, and the House is run by Democrats, the Senate by Republicans. The big holdup really is the House really thinks it's important, and I have to agree with them, to provide some federal assistance to the states, because state budgets are really getting whacked, and cities and towns to some extent too. And the Senate, meanwhile, their big priority is immunity from businesses from COVID-related lawsuits. And I think just the Senate doesn't want to spend, Senate might want to spend $1 trillion, the House 3.5 trillion, and the House is willing to come down. The Senate doesn't seem that willing to go up. So I think we will eventually we have to see something more from Washington, and there will be some money in there for small businesses. I think that it's hard to tell exactly what it's going to be. One thing I'd also say is that while the PPP is essentially that money's running out, in terms of the money that people have received and are spending it, there's still some money in the PPP pot that didn't get spent at the federal level. But there's what's called community development block grant money that came to the states. This is tens of millions of dollars that came out of the first CARES Act that has not been deployed yet, and that money is intended for small businesses. So I'm trying to find out what's going on with that money, because I think that would be really helpful for a lot of small businesses in Massachusetts, and that could be distributed as grants, assuming that it can be distributed. It's now up to the state to distribute a lot of that. So that's going to be a focus of my reporting over the next couple of weeks.
Definitely. Well, we'll have to stay tuned for more updates on that. Another question, do you see the state ever moving past phase 3 to part 2 or phase 4 this year?
Well, so phase 3, part 2 was postponed, quote, indefinitely by the governor earlier this month. I think part of it was there was a slight uptick in COVID cases in Massachusetts. I think it was also a reaction to some of the news of some parties on the Cape where there was some spreading of coronavirus. And also there were 2 large gatherings. One of them was a wedding, maybe both were weddings, at a hotel in Gardner that clearly were well above. They were outdoor gatherings, but the limit is on 100 people in Massachusetts, and they were well exceeded that limit. So, governor wasn't happy about that. So he basically said, we're postponing phase 3, step 2 indefinitely, and we're reducing what's allowed in outdoor gatherings from 100 to 50. So there's not, aren't many businesses in, this is not to, I understand, I feel for the people that are in step 2 of phase 3. But it's more, it's sort of indoor performances. But you really can't have too many people show up because the indoor gathering limit's 25. So it's indoor performances, and it's some outdoor sports involving some contact with other people are really the only businesses in phase 3, step 2. Of course, the big question is phase 4, when the bars and nightclubs can reopen, when the ballparks and concert venues can reopen, and that I don't see that. So phase 3, step 2, I think it's realistic to see that happening sometime this year, assuming we don't have a big spike, assuming we're still at like testing rates around 2% going through the fall. But phase 4, I don't see that happening until we have a vaccine, a widely available vaccine, and that's probably not going to be until 2021, unfortunately.
Gotcha. We had a question about the transportation bill. Do you know anything, have any reporting about the transportation bill?
So what's it? So the transportation was the hottest topic in the State House before the pandemic hit, and obviously it's dropped a few notches in terms of priority because the traffic jams are almost nowhere, congestion on the trains. I mean, some of the buses are getting pretty, filled, but it's not really a pressing problem right now. So what the House and the Senate did pass what are called bond bills, which authorize the governor to borrow money for transportation projects. This happens every 4 or 5 years. They need to reauthorize borrowing capacity. There's some reforms in those to make it easier to issue contracts for various transportation projects. But the big question, I think, the questioner was asking about what's going on with the gas tax. Gas tax was passed by the House, but not by the Senate. I think we're going to see a big revenue debate at the State House once we know if the state is getting, what kind of assistance we're getting from the federal government. I talked about this before. The Senate wants to spend almost $1 trillion to just divvy it up to state and local assistance. The House wants to do that. The Senate does not. That's at the federal level. They'll hash that out. I really got to believe that the House gets its way to some extent with some state aid. And then here at the State House, they're going to have to work on a budget. And so while raising the gas tax before might have been a way to pay for, maybe more trains, other interesting transportation projects. Now I think raising the gas tax is going to be on the table just to plug the big budget gap. I mean, we're looking at a few $1 billion in budget, the budget hole. So I think even though the Senate did not agree to a gas tax increase, I think it's still going to be on the table this fall during budget negotiations. And that's something that if you're concerned about a gas tax, you should definitely keep an eye out for it.
Definitely. We had another question about any additional fallout or job loss that's anticipated after October 1st. Do you know anything about that, John?
Well, I honestly can't. It's hard for me to predict where things are going to go with the job market now. I'll say in Massachusetts, where our unemployment rate is among the worst in the country. And while that sounds kind of horrifying, I mean, when it did hit 17%, I believe it was the worst in the country. I think I'm hopeful that that's actually a good sign, that by being stricter about reopening, we've sort of contained the virus here. And the governor has been pretty conservative about reopening. So I'm hoping that as long as we keep the COVID levels from spiking, I think the job losses will be primarily behind us. The big question is, now that the PPP money is running out, the small businesses still need a bridge to get to a better economy. And I don't know what we're going to see or how much money is going to come through from the federal government. And like I said, there's some money at the state level that can be distributed that came earlier from the federal government to help small businesses out. Yeah, obviously the big challenge are businesses that rely on walk-in traffic. The companies that can work virtually are, they can do the job still. But I know retailers and restaurants. I mean, it's heartbreaking. Every week I hear about another restaurant that's closing, and maybe it seems like maybe every day. There is a restaurant relief package in debate at the State House, but and that would bring grants to restaurants that need it. But the grants are not large, and they still only buy you a little more time. And that's I think the challenge is that all of these programs really are just buying businesses just a little more time, with the hopes that maybe the economy bounces back a little bit more. And I'm really hopeful that 17% unemployment rate is the worst that we'll ever see in Massachusetts, and that now that the economy has sort of been tightened, it'll improve as things reopen, and as fingers crossed, as COVID numbers don't spike.
For sure. We had another question come in around performance arts, which you kind of just talked about in terms of, no one knows when those are going to be a possibility in terms of live audiences. Basically, this question, any thoughts on kind of the long-term effects? Obviously, the short term is kind of just up in the air. No one really knows when it's going to be a possibility to have audiences, but kind of, Boston, performance arts is a big part of the economy and a big part of the culture. So what are your thoughts in terms of, anything changing in that industry?
Well, I know there's a big push. This is not, as far as I can tell, it's not among these two competing bills in Washington, but there's a big push in the performing arts community to, it's called Save Our Stages. And there's a similar effort to, I can't remember the name of it, but just basically to get some money to kind of give some of these businesses that have no income coming in, to keep them around. I worry that this is almost an extinction level event for performance venues. Live Nation can hold on a little while longer, but some of these smaller businesses, they have no revenue coming in, and like I said, no revenue probably will be coming in until we're at phase 4 in Massachusetts. So what some musicians and other performers are doing virtually, and they're looking for donations. It's not a sustainable business model, unfortunately. That's, you can only keep that going for so long, particularly for, I think about musicians who used to make money selling CDs, records, they're not, that business model was kind of disappeared, and they really had to make money touring, and now they can't do that. So I think some musicians are doing they're doing classes online, and they're doing chats online. I saw one musician advertising for, she's a fairly well-known musician from the 90s, who said, I'll give a greeting to your friend, just pay me a little money, and I'll do like a minute-long video for your friend on their phone or something. And so I think you've got to be creative. I think if you're a celebrity, you might be able to do a little more with that than if people don't know who you are. But it's a real challenge. And like I said, I spoke to the guy who runs, Joe Spalding, who runs the Wang Center, which is the Wang Center in the Schubert Theater, which is the Bach Center for Performing Arts. And he said he does not expect, he would not be surprised if their live events don't return until late 2021. And they're nonprofits. They have sort of, I think it's like maybe $10 million in two sort of endowment funds that they can kind of live off in the time. But he did have to lay off most of his workers because there was nothing happening. And he actually had COVID himself, and when he was laying these people off. So he had a pretty rough spring. It's not looking good, but I think you've got to be creative. I think we're going to see a lot of people just drift into new professions outside of performing arts, which is sad. As someone who likes to go to these events, I think it's a really disruptive moment for that industry.
No, it definitely is. We had a couple questions come in through the Q&A box. We had one question about housing evictions, which I think we talked about last session. This person's asking about housing evictions for elders specifically. Does that fall under the same moratorium, the one that we've been discussing?
Yeah, so the moratorium has been extended until the middle of October for evictions, but there's talk about extending it further in the legislature until the end of the year. The problem with the moratorium extension is you're still stuck with those rent bills after the fact. So the longer you put it off paying, the more you're going to owe when the time comes. This has been particularly challenging for restaurants and other businesses that, small businesses that aren't seeing much revenue coming in. They can't count on that money coming back once the eviction moratorium is over.
Definitely. We had another question, and I don't know if this is in your wheelhouse, but have you heard anything about the primary and general election mail-in ballots?
Yeah, that's not my wheelhouse, so I don't know. I have heard that I have seen photos of the Postal Service taking mailboxes away from various neighborhoods in and around Boston. They would say it's because the amount of mail has gone down. I'm sure there are a lot of people who have different theories about why that's happening. I guess I would just say that, right now, we have a primary coming up. So if you want to vote in the primary, you really should, if you don't feel comfortable voting in person, you really should get that mail-in ballot out there.
Yeah, definitely. Do you have any other closing thoughts? Anything we haven't covered yet through the questions?
I don't know. Do we have any other questions coming in that you see that might be good to cover?
We had one more question, and I don't know if this is in your wheelhouse, but will there be a federal tax stop out of paychecks?
A federal what?
About that tax stop?
Yeah, no, I don't know. I'm sorry, I can't. I'm not quite sure what that means. I think we really have to watch this debate in Washington with over these two stimulus bills, and I think that those are going to be, how that gets resolved is really going to set the policy for federal assistance for the rest of the year, because there will be others coming up, but this is really intended to be the big bill that gets us through the fall.
Definitely. We had one more question come in. Do you anticipate an uptick in the gig economy with so many people pondering new career paths?
Yeah, it's a great question. I have been thinking about this. Some of these businesses have really had challenges. Certainly Lyft and Uber are struggling with the reality that people aren't taking as many trips. They don't feel comfortable getting into strangers' cars. But I do think you are going to see so many people try different things to pay the bills that I think that you're going to see businesses that we haven't even really thought of, or maybe they're out there but really small, take off to kind of to capitalize on new kinds of quote gigs. Maybe it's not driving a car, maybe it's not renting your house out, maybe it's something else. I do think that's going to happen. We've been sort of moving in that direction anyway. People talk about how COVID is accelerating certain trends, like online shopping. I think the gig economy is another one that COVID could certainly accelerate.
Definitely. Well, John, enjoyed it as always. I think that's all the questions that we had come in. So enjoyed it. Anything else you want to add? Or are you good?
I think that's it. Let's hope the numbers stay low as we get into the fall. I know there's a lot of concern they're going to go back up, and it's a little unnerving looking around at some of the other states and what's happening in there. But the Northeast, we seem to have done the right thing, even though it's been painful for a lot of people.
Definitely. Well, this was our 11th session. We just found out before we came on. So whether this was everyone's first time or 11th.
Coaster ride, that's for sure.
No, definitely. We've covered a lot in 11 sessions. So always enjoyed it. Always appreciate everyone tuning in.
Yeah, I hope to see everyone back here.
Awesome. Thanks, John.
Thanks, Alex.